Hey everybody, this is producer Eric. So, Karin wanted me to let you guys know something. Before you take any of the advice she offers on the show, please speak to your medical doctor. Also, when you do take Karin's advice, please understand that results will vary per person. Alright, let's start the show. Hello, everybody, and welcome to Shit Isn't a Dirty Word. And let's get right to our host. Karin, how's it going today?
Everything is amazing. Sunny California, some winds around, a lot of viruses around. Just be careful where you go. Stay
That's
away
right.
from.
And the other voice is Larry Sands. How's it going, Larry?
I'm good. I'm good. You guys, I think now is a really good time to do a detox with all the viruses going on. I think that's the biggest deal. And speaking of viruses, and try to do the ninjutsu shuck and jive and whack-a-mole all the viruses off. We have Steve with us. He is back from the Santa Monica Pharmacy. Hi, Steve.
Hi,
How are you?
I'm Greg.
Good. I can't wait. It's been a while, and we haven't talked I don't know, for a couple months, and we know you've been out of the state. So can't wait to talk about what you have going on. And then we got a really great chiropractor on the show with us today. And thank you to Steve. He brought Dr. Brian on. Hi, Dr. Brian. How are you?
Good. How are you guys doing today?
Amazing.
Good. Happy to have you on, Dr. Brian.
Happy to have you.
Thanks.
Yes.
Thanks much.
Now this is the part of the show where I am just going to kind of kick back and relax and listen to some really good talk about detoxing and things to eat and vitamins to take and how to pop yourself back into good health.
Pop
Is that
yourself back in.
I know, and there is never better time than Thanksgiving to thank for every shit we put in our body.
Oh yeah. Well, this is the time of year where the weather changes first of all, and we're not ready for it, right? And so we go out and we do stuff, and maybe we get a little chilled or something of that sort. Next thing you know, we're a little vulnerable. Then we get the stresses. Oh no, I mean the pleasures of the holidays, right? And then and family, etc. And then we maybe get a little stressed out, and then maybe there's a lot of pressures on us. And next thing you know, you're a little vulnerable, and then next thing you know, something comes in there and goes, "Gotcha," right?
Yes.
Yeah, and
sure.
so that's where we have to, so you have to sort of take it a little easy during the transition period here, because that's a really vulnerable period, especially the holidays too. So transition and through the holidays, it's like the beginning of it's like an acclimation period, and you have to sort of stay a little frosty mentally as to what you're doing with yourself and with your health and everything else. So there's a lot of things that you can take preventatively, et cetera, et cetera. So I don't know, Steve, you got some ideas?
Well, there's never like a one size fits all for every person. It all depends on what your predispositions are and your weaknesses that you recognize after years of coming down with different health problems. But there's the obvious things people can do. They can be on a really good multiple vitamin just to fill in the gaps for where they're not picking up what they need in food. And we have a tendency this time of year not to eat as well. We cheat a lot this time of the year, especially with sugar. And so if you're not already a pre-diabetic, you're going to become one between now and December. So it's a good idea to take things to prevent that from happening, which might make up B vitamins, or there are glucose balancing formulas out there. There are homeopathics, herbs. But it really depends on the person, who that person is and what their weaknesses are. There's some people that appear not to have very few weaknesses, and they seem to slide by the winter months without too many problems. But it really depends on the weather changes. If it gets really nasty out there with the weather, then our bodies are going to be working twice as hard to maintain a 98.6, which is, you know, the ultimate temperature for the inside our bodies to keep us from getting sick. And the more challenges that happen with the temperature outside, the harder it is for our bodies to keep ourselves healthy.
Yeah. Well, we're looking at here a lot is actually some of my background is I have a company and we manufacture a health product line, and we also do contract manufacturing for people. And one of our biggest sellers right now is olive leaf extract. We have like a 40% oleoropine. It's a really great product, and olive leaf has some research towards it being an antiviral type of product. So it becomes very popular, and we've started selling quite a bit of it at this point. And so that's one of the things that we look at. And there's a lot of other immune boosters. We have the Instant Immune product is a liquid product, and that is chock full of a whole bunch of different immune boosters, and people can start to take those. You can up your vitamin C content, your antioxidant content, and take a lot of those good veggies, you know, and fruits, and, you know, kind of stay frosty and stay tuned in. So we're looking at a variety of health products, and I always look at your the pharmacy as like having a whole variety of things, angles that you can go to. Now you can go to vitamins and herbs like we're talking about. You can go to Chinese herbology. You can go to Western herbology. You can go to some amino acids and some the vitamins and the minerals, as well as all the Chinese herbs that are happening. There's acupuncture. You can go down that line. You can obviously, you know, lighten up your diet and keep yourself in weight control area so that your body doesn't have to deal with that right now. So you can approach it from a bunch of different angles to try to really stay healthy. Detoxification is a good thing, but usually we, you know, it's seasonally sort of a springtime type of deal, but because you wouldn't want to be too, because sometimes with detoxification you can start to go through reactions, and maybe the fall's not the best time to do that as you're trying to build up your defense system during the fall. What do you think about that?
I can add to, I will add to it, because this is because I can't tell you how my week look like, because everybody wants a cleanse before Thanksgiving, after Thanksgiving. I'm in 2 months waiting list right now for after that holiday. I know. So few tips. First of all, maintain good health is always good. Less sugar. I would say more bone broth, more broth in general, vegetables. I would add some green juices on daily basis, which they're amazing.
Right.
Antioxidants, like I always recommend to my friends, family, and clients, eat whatever you can get from food is 10 times better. Sage tea, like but sage tea, as it sounds, to take the sage leaf with hot water and drink it as tea. This is amazing detoxifier, and it's amazing, special right now with all the sickness around, all the viruses. It kills viruses, it acts like antibiotics, and the results are amazing. The same way we purifying, you know, the rooms, we purifying our body. Myself, I drink a lot of sage tea. I recommend it to my client. There is also a lot of remedies that people can do actually at home, which is a little bit of honey with some vinegar and some lemon. We mix it together, and I let it stay, you know, in the fridge, and I use it with a spoon, exactly like any other coughing syrup, and it works amazing.
My mother used to give me that, right? Yeah.
We didn't
Only-
really invent anything. That's exactly the point. The point is that we can use a lot of things from our house. If we take like even just garlic with some lemon and honey and mash it all up together, we create a great cough syrup. This is amazing for any type of flu. But the main idea is a lot of fluids as it goes. Like you mentioned before, vitamin C's, that it's amazing. Now it's also the time for tangerine, mandarins, and oranges, which is amazing.
Yeah.
Yeah.
Well,
It's
my
always
mother
right
used to
time.
give me, my mother would give me the lemon and honey, warm water. But then she was British, and so I used to get a shot of whiskey with it.
Okay, so you're British. A whiskey is great. Now, don't laugh. A whiskey is great. I'm half Moroccan. In Morocco, they used to give, we call it arak, but it's something like the black sambuca. It tastes almost the same. It's licorice, and it's the same thing. It's cooling out, burning all the viruses. I mean, as growing up as half Moroccan, you have this alcohol pretty much for everything. You have toothache, they soak it in thing, they put it. You have headache, they soak it, put it on your head. Stomach ache, they spit it on you. I mean, we use it as a medication for everything.
I know
Now it
alcoholics,
become like a
they don't get
beautiful-
sick because they're so sick
Right.
from the alcohol. No, but literally there's probably something to it because alcohol, is used as a solvent in a lot of herbal extracts because it really prevents the
preserve it.
growth of any bacteria. Yeah.
That's right.
So
Right.
let's say not too much alcohol, but
Just for the
it's
fun of it.
absolutely.
I
It cheers you
always
up.
say-
It cheers you up too. Let's say. Yeah.
As I always say, whatever makes you happy and cheer you up, do it. Don't do too much of it. But yes, we talked about like the holidays, and I'm American, but I am Israeli. So like for me, Thanksgiving is something new that I never knew about what's the ritual of that holidays, because everybody's saying like, oh, I'm gonna eat so much. And for me, it's like, I'm Israeli. We eat the same amount of food every Friday night, but we don't binge on it. I make a lot of food, but we don't eat it all day long anyway. And that brings me to the next level. Even if you plan on eating a lot, like protein, which is the turkey, so take some enzymes to break it, or do some exercise like walking, some squat, not lay down, eating, drinking some beer, laying down on the sofa. Then you are bloated, then you're tired, then you're fatigued, then problems start. And of course, and then you inhale all the sugar, all the pumpkin pies and pecan pies and whatever
And
pies.
forget about it.
And then you need a chiropractor because
Yeah.
you never sit there.
Yeah.
And
So
then
I
you
should be
rethink
telling
it
people to
twice.
do that so they come in. Right?
I know, right? Not just after accidents. They need to. I mean, chiropractor. It's something. I mean, I wanted to ask you, how old you need to be to start with chiropractic treatment? Because my daughter, she's 14 and a half. And right now, let me tell you, the TikToks are all over with chiropractors. Even though I'm using chiropractor for pretty much all my life and I love it, but what's your suggestion for kids, like as far as
Well, no, kids, it's important because I think kids, when your bones are forming, that sometimes that's when the problems occur. For instance, say you're a young child and you get into a sledding accident, you're sledding down and you fall and everybody falls all over the place, but you end up with a little bit of a whiplash or your back's thrown out. It could cause a scoliosis or curvature problem later on. So if you go in and you have a chiropractor gently kind of restore things and get everything straight and lined up again and moving and all the kinks out of it, sometimes you get what's called a functional scoliosis or something where you may have injured yourself as a child, and So your muscles sort of spasm up and twist things a certain way. And then as you grow and your bones keep forming, they form into a wrong pattern, you know, because
Right.
it's pulled out already. So basically I think it's a very important thing, you know.
So you say like 13, 12, 13 is
Oh
good
yeah,
number
even
of
younger, even
Even
younger.
younger?
Yeah.
My
Yeah,
kid, my kid who's almost 18 now, he had his first adjustment when he was 12 months old,
Whoa.
but
yeah.
he was
Yeah.
laying on my chest. I was on my back. He was face down with his chest on my chest, and it was gentle, but they did adjustments when he was just 12 months old.
So my kids are having massages reflexology since the day they were born.
Yeah.
So I do cranial sacral on them, but chiropractor, it's like really, one sec. It's really not something I took them to, even though my best friend is a chiropractor. And see, I learned something new every day. And like, I guess some, kids go today with all the TikTok thing, and I think it's very big now. So
Yeah.
I don't know.
Yeah. Yeah. You know,
But
I must say,
Mom, adjust me. I'm like, okay.
to add to that, you know, there is, because on TikTok and I know Snapchat,
Mhm.
because my wife watches it, then she loves to watch all the people get adjusted and they put the microphone right up.
Mm.
So you
Yeah.
can hear every
Yeah,
every
to hear
crack.
the
Yeah.
cracks.
Yeah. Yeah. And
So I do
let me ask
cupping
you,
on them since forever. Like cupping is something my kids love, and it's amazing. Another form, but not chiropractic. But chiropractor, I mean, I'm gonna take her. See? Thank you.
Good.
yeah, yeah.
And
How
what
important-
else chiropractor is good for? Like now, winter time, detox time, rejuvenation of cells, like a New Year resolution. There is so
Well,
many things.
yeah, absolutely. I mean, if you keep the basic idea is that you're keeping your spine flexible and in alignment. You're keeping your nerves, energy flowing through the nerves and into the muscles and everywhere else, because the nervous system connects to everything. So if you've got that flowing nicely, it's very smooth, et cetera, then you're going to feel generally a lot healthier and be a lot more resistant to everything, really.
And what do
So
you
it's
say would be a safe thing to do? Like how many treatments? There is minimum, there is once a month, there is maintenance. Like how
well,
would I
I
know
would
each
say,
case is different, but
yeah, I mean, it's obviously different. If you have an injury or if you have a particular problem, then it's different. So you have to consult on that. But if it's just maintenance and keeping things, from uh, being locked up and keeping things flowing and flexible, once or twice a month, is great. If you
amazing.
can do it once a month is great, or if you have no problems, if some people are fine. If you're really active, maybe a couple times a month if you're doing a lot of sports, just to make sure you're all right and keep things on the alignment, so to speak. So
You
that's what we
know it
call it.
like me that the world split to half. 50% have back problem and the other 50 will have. So no one
Yeah.
is like
I know.
staying
Yeah.
away
Gravity,
from that.
called gravity. Yeah. It's
And sitting too much in front of a computer.
oh my God.
Oh.
Or
That
brutal.
too, and also the fingers. I mean, the structure
Yeah.
of like holding the phone and like doing that all day, or the meta thing, the
Yeah.
Yeah.
Oculus thingy.
I never learned to do the double thumb thing. I should, I guess everybody does that. They're pretty good at it.
I'm telling you, they do that, and then they have a lot of carpal tunnel syndrome. I mean, a lot of kids suffer from carpal tunnel because I do treat them with massage, so, and some hot wax and stuff. But yeah, at the end of the day, you don't know why your hands are like so tired or ache, and then you remember you texted most of the day, like,
Oh, yeah.
Well, they should all be really good at thumb wrestling and stuff.
right,
I
right.
know.
Hey, Karin, when you did the thumb, I almost thought, oh, you're a gamer, Karin, because
No, because I use for something else. I use it for.
Yeah,
Yeah. Yeah.
her
Yeah.
hands are
I use
very.
mine like that.
Yeah. It is important because I know from talking with Karin, like to have that flow like of your gut. But in what I hear particularly from you, Dr. Brian, is when you are aligned and all your for the lack of all your bones are good and in alignment, there's a better flow and an energy, right?
Well, yeah, because all your nerves go through your spine, so they go through this, the central cord goes through the whole spine, and then the nerve roots come out at every section. So they innervate everything.
Yeah.
So everything from your brain stem on down is goes through the spinal cord. And when you get adjustments, it not only aligns the bone, but it has all these other effects on relaxing the muscles around it. And if you had been tweaked something or had twisted the wrong way or been in a little bit of a sports injury, minor, maybe to where, it's not that big of a deal, but it's sort of creating a little bit of a misalignment, a little bit of a nervous problem. It's not completely clear. And especially if you think up in your neck, you get everything clear and aligned there, then your head's sitting on your body in an easier and more correct position, and everything is the nerve system then that's housed in there is flowing better. All the muscles are relaxed, they're flexible. When you get an adjustment, also releases some enkephalins, endorphins that tend to really sort of feel good and spread out on the nervous system and through the muscles, so that you're just feeling like, okay, I feel in alignment. I'm not like, moving and then moving and, oh, it's stiff, and moving and it's like, oh, there's that little tweak, and oh, I can't move too far that way, or it's like all those little things kind of add up and are, you're not quite right. So the point is, the more you can get yourself in that alignment, just as in health, you can get yourself in homeostasis or balance, and when you do that, then you're much more resistant to everything that comes around the pike. And, talking about
Also
the immune
breathing.
system.
It helps
Yeah.
so much with breathing, because when you adjust,
Right.
it feels like it's like opening
Mm.
airways, and it's amazing. It's amazing. It's again another detox.
But let's talk about something I just came to my mind in the immune system, is the benefit of natural immunity. The benefit of actually exposing yourself to different bacterias and things, and when you're young, to build up your immune system, when you're older, to keep it, frosty and active. There's a lot to that, right? It's not like the goal is to live in a bubble and never ever get sick of anything, because as soon as you took the bubble off, you'd be really susceptible, right?
Mhm. Yeah.
Exactly, even more so. So
Yeah.
that's I think something we should discuss in today's age, that getting a little sick, is not a bad thing. It really helps you develop an immune system and a recovery system that's going to be much more resistant. And you sort of have to, and I, I think, challenge that every once in a while. Even though some things you get lifetime immunity, there's other things that you have immunity for many, many years maybe, but then you get sick again a little bit, but that's actually okay. And I always try, because there's this thing, and we haven't discussed homeopathic medicine much, but there's this thing in homeopathy, this theory that, well, it's not really a theory, but you talk about cure, palliation, and suppression. So that was always very important to me, because the definition is interesting. If you cure something, that means you've done something, like you've taken something, you've done a treatment or something or other, and you've cured the problem, and it doesn't come back again. You've cured. Palliation is that you're okay as long as you keep doing that thing, like insulin, for instance.
Right.
You stop doing it, you still got the problem. And then suppression is the interesting one, because that's where you can actually take certain medications, usually stronger ones like allopathic ones, and actually suppress the immune system to the point where you no longer have that symptom that you had, but now you've got a symptom that's deeper in the system, actually worse, you're worse off. So in other words, you start out with a skin rash, you suppress it with a cortisone cream and you think, fine. Next thing you know, okay, I've got a kidney or a liver problem. So what's the more severe? Well, obviously the kidney and liver problem is more severe than the skin rash. So you've just suppressed the problem. You've actually taken the immune system response, you prevented it from acting, and so you've suppressed the system. And a lot of times you see this, and it's not something we look for because we don't think in those terms. But basically, you could be getting a particular cold, virus, etc. You keep getting it. You take some very strong antibiotics or steroids or something of that sort, and you cure, you suppress it, and then a few months later, you get the same darn thing again, and you have to do it all again, right? You're never completely cured. You're never completely free from getting ill again and again and again. It's not like you on your graph, you're saying, well, I didn't get ill this year. No, you get ill every year, same thing. So it's because you're probably suppressing your immune system, and then it comes around again, and then it easily pops out again. Gets a little signal and pops out again. So that, I would say, is when you're suppressing something. Now, if you got through that particular flu by doing just, your diet, your health, sweats, acupuncture, herbology, other things that didn't suppress it, but boosted your immune system. So then you got through that, you boosted your immune system, and now you're less likely to get that again. So chances are you're much more resilient, and your immune system is able to go a lot further in time with that type of resistance.
Wow.
Which brings me to be related to, I'm a naturopathic doctor. So in our core, we treat the core. It's what caused the problem, not the symptoms, not what it is. Being a mother of 4 kids, they sneeze, they have sore throat sometimes. And my doctor always laughing at me because I usually don't go to her. And if I do, it's after they pass everything, and she just makes sure they're okay.
Right.
Because, a fever, it's a good thing. That means our body wants to fight, and it
Yes.
fights again. I'm not going to go against the wall if it passes certain, numbers that are risky. Of course, I will give something to lower it, but I will do vinegar, I will do bath, I will try to reduce the fever in different ways. When they were little, they couldn't breathe, I used to take them out, and it was freezing outside, just to breathe fresh air, and that would actually help them more than any other humidifier in the house. I used to put eucalyptus. Again, there is a lot of methods to use things, and you're so right. Sometimes we have, not sometimes, we have viruses all day long.
Mhm.
And I'm not taking medication, never did. And touch wood, I passed COVID with asymptomatic twice. The
Wow.
only symptom I have, I think on the second time, I had a sore throat. That was it. And I don't know. And it passed after a few days by itself. I did drink a lot of sage tea, and that was it. But what I'm trying to say, even for as a mother, because it starts there, washing your hand when you use the restroom is one thing. Playing in the mud, I'm happy. Play, touch. I'm not wiping their hands with Lysol or with any other.
Right.
That's what we did during COVID. We washed the bacteria. We were so open up to get the bacteria instead of being dirty and not getting the bacteria. bacteria. You know, it's like,
Well,
and it's
yeah.
okay. We grew up like, I mean, I'm laughing about it all the time, but we grew up barefoot, naked, going on the mud. I mean, we drink water from fountain full of corrosion, like whatever. It was us and the dogs. We 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 were very active. We never had like obesity. I mean, we were pretty much healthy kids. I mean, you should agree with me if you were born on 1970 or before that. That's how life was. We play a lot outside, so we were exposed to a lot of a lot of everything. And how many times we dropped food and we actually ate it, and that's a good thing also for the immune system.
That's
What
a
is it? The
5-second
5-second rule.
You know, I think there's
Go
a,
with
you know,
10 minutes rule with the things that they are giving you in the
yeah,
restaurants. Are you kidding me? You better drop your food. Like, it's gonna be cleaner than the restaurant sometimes. And
yeah, well, that's true. You know, there's an example of, I mean, we have to judge things according to the circumstance, you know, and obviously, pretty much everybody can tell if something's really serious, then you have to have a serious remedy and you have to have an immediate remedy. And I think allopathic medicine, their best offers are for emergency type medicine. I mean, if you
they're
get hit by a
amazing.
bus and you're laying in the street, you don't want a homeopathic remedy. You want to get taken to the hospital, you know. So you have to judge everything appropriately,
Same
of
thing as
course.
appendicitis.
Yeah,
You need
yeah.
a doctor. You know, it's like, doctors are amazing. I must say that. I mean, I don't want any of the audience to think that we don't. I love the doctors. They're doing amazing job, especially when it comes to major things like heart disease and like um, any other procedure that we really need doctors for. The only downside, and again, not to all the doctor, downside, it's that a lot of the time they just don't listen to you.
Yeah.
And
Well, the thing,
they just don't
what
listen.
I have is like they're really good at emergency medicine, heroic medicine. They're the best in the world. I think the problem is when you try to take the same philosophy that patches up a bullet wound or does something dramatic, and you try to apply that to chronic illness, it doesn't always fit. There's a lot of different things in more chronic illnesses, and that don't fit that paradigm of heroic medicine. But it that gets back into sort of the history of medicine, and Steve knows the Flexner report, and the doctors coming back from the Korean War and starting the AMA and this sort of thing, and instigating the heroic medicine philosophy for all medicine. That's why it's very hard for them to incorporate other things that are like an acupuncture, oriental medicine, herbology, things like that, because their paradigm is like, hey, this works for a bullet wound. What the heck? It'll work, you know, all the time, but it doesn't always do that. I can give an example, for instance, from getting COVID myself in last Christmas, and having some symptoms that were sort of like the flu. And I did about everything. I did everything, literally. I did all my natural stuff. I did the zinc. I did the vitamin C, the vitamin D. I did, you know, the quercetin, all that great stuff. Ended up also getting some ivermectin from a friend, and I got some hydroxy chloroquine
Yeah.
as well. Yeah. So I was doing everything. And and part of it was because I'm a health practitioner and I wanted to see what these things did, you know. I'm actually saying, well, which one's going to really kick in here and really work, you know? Well, the flu part went away in a few days, but I have a weakness in the lungs. And so it went right down to the lungs, and it started to grab me in the lungs and started to inflame the lungs, and started to make them like you could just feel it, you know, kind of increasing the attack and causing that reaction. I forget what you call it, Steve, the overimmune reaction in the lungs that starts to become scar tissue if you leave it too long. And that's where people were being taken to the hospital only when they got so ill
Hospital.
that
Right.
that they had actually had too much lung damage already, and me putting on remdesivir ended up having side effects for the kidneys. So I was taking things like I go to the over-the-counter nasocorticoid steroid, inhalers and different things like that too, just to see, what I thought worked and what didn't. And in the end, because I saw it attacking the lungs, I had to, and I knew this because I had several friends that had gone through this. I said, I've got to stop it from increasing this immune reaction. So I luckily had some prednisone in the cupboard, and I started taking the prednisone just to kind of decrease the inflammatory response in the lungs. So then when it decreased, I was able to handle it with regular natural things. So basically, I came to a lot of conclusions for me, but basically I think the hydroxychloroquine would have been helpful before I got it as a preventative, or maybe right in the beginning. The ivermectin seemed to help a bit. And in the end, the steroids sort of calmed it down enough so that it didn't turn into this immune system reaction that was so great that it actually caused damage to the tissue. But that being said, 6 months later, I got sick again with the same symptoms. So that's kind of back to what I was saying. And only this time it was mild enough that I just said, I'm just going to do my vitamin C and everything else. So I let my natural immune system come in and take care of everything. And I'm kind of goes along with my theory. Of course, it has yet to be seen because we have to go to the future. But basically, that you don't want the suppression. What I looked at is I suppressed it. I kept it down when I had to. It came back because it was suppressed, not cured. And then I dealt with it then. And now hopefully I've established a strong natural immunity, and I can go forward. I don't know if that's too complex, but basically that's what I go through. Yeah.
Or you were thinking about the cytokine storm.
Yeah, at the end of the day, it all makes sense that if we do and keep, and it's okay to keep our system a little bit like on the edge and let our body also to push it. Again, we need to have our brain too, if not to push it too much, but and not to be, it's something also for life. It's like we can't be to either side. We always want to keep the middle to what works for us, not work for my client or my neighbor. I mean, each body is different and each one reacts different and each one comes to that point differently. Same thing as the vaccine, if you got it or not, there is a lot of influence of the last flu vaccine that maybe there is, and there is also a lot of other medication that people are taking, and we don't know even to make the connection if that's another trigger to everything. A virus is a virus. We need to be in tune with our body of what we need to do, what we don't need to do. It's great to have connections like Steve, that like your pharmacy, that you have a variety of doctors, herbs, because the idea, and I think, Larry, we talked about it on the last podcast, the idea of natural medicine or holistic medicine, that's my world, is to complete regular medicine. We're not alternative to anything. We're really not alternative to any medicine. We're coming to complete whatever treatment we start with the regular medicine, or the opposite. So working together always gonna give the best result.
Integrative.
Hey, Google, stop.
Integrative. It's always giving best results is when you start. I will share something with you. So today I'm very happy. You can see it on my face. Not because I'm going to New York. It's because my husband finished.
Oh, he's done?
Last chemotherapy. Yeah, today is the last chemo. Unfortunately, he started with cancer almost a year ago. And we do treat with homeopathic treatments, with herbs. We do a lot of combination of things and chemo, unfortunately. I worked pretty well because he's really good. He's doing great. And the thing is that his doctor, and this is example I gave last time, his doctor doesn't like me because he doesn't like
Oh, no.
my approach.
Right. You go against the authority there.
Combine things together. And I was talking to my husband, when he was getting his chemo, about colonics, detox, about the herbs he's taking, about the chiropractor he needs to see, about hyperbaric chamber, about all the detail, because I have a lot of work to do from now on. And he came to me and was like, I don't like that you're talking about it. I'm like, what's wrong with you? I'm talking to my husband. It's a free country. It's the
Right.
I was like all
Exactly.
over, and I was like, what is your problem? Because I'm trying to cure my husband with other things, with the fact that you're poisoning my husband so much. I mean, as far
Well,
as you're
right.
concerned and any other oncologists, they will finish with the cancer. So today he called and say, that's it, we're done with the procedure. Amazing.
Well,
Doesn't
I mean,
care
that's
that my
one,
husband doesn't sleep at night. Yeah.
the procedure is so toxic that you can die from the supposed cure, because it can be too intense.
I know. And that's what I'm saying. Like, he doesn't care that my husband have tingling all over his body. He cannot
Right.
touch any cold things. He have insane pain in the whole body. I'm massaging him 3 hours a day, mindfulness, reflexology. I mean, the doctor doesn't care. I mean, as far as he's concerned, he's done with the treatment. Amazing.
He
What
doesn't
I
understand the real work starts now, right, Karin?
Right.
Well, yeah, I have an example of that. That's when I first started
Yeah,
practicing,
and that's the thing that
I was in Fort Collins, Colorado. And can you guys hear me okay?
Yes. Yeah.
Okay. And I had a patient come in
Yeah.
and said, well, I have this teeth pain. And I said, well, and I'm here because I went to my doctor. My doctor gave me a medicine and it didn't work. And I came back and I said to the doctor, doctor, it didn't work. The doctor said, yes, it did. And and I said, what? And she said, the doctor said, yes, it did. And I said, no, I still have the pain. And so she, the doctor apparently was like, look, I know medicine. I gave what I'm supposed to give. And so it says it works, and it worked. You need you need some mental help.
What?
Yeah. Oh yeah. And I thought to myself, yeah, this is unfortunately, I think the mentality becomes so much about statistics that it's like, statistically this works, so therefore I gave it to you, it works. And to the fact that they almost put blinders on beyond anything beyond that. And now they're being more and more regulated and even forced into obeying the rules from the AMA and the code books, etc. If they don't give the right thing for the disease, if they go off chart and give something else that they think, they'd be a little creative, or they've heard of something, or they've seen it work, even they can't necessarily give it. Their license is threatened, so it's become very, that's why luckily I know enough about medicine that I go into the doctor, I look him in the eye, I say, and he knows, not to pull that stuff with me, because it's kind of like, they're not really if they give you something and you happen to be at that statistic where it doesn't work and you die, well, gee, so what? He tried, right? He gave the right thing according to the book.
So this is what I had with the doctor about 3 weeks ago.
Yep.
On one of the almost one before the last cycle, and he was saying so many things, and I asked him, like, nicely. I tried to be not rude. My husband wanted to kill me, but I was like, and I asked him one question. I said, did you ever try what you gave my husband? And he looked at me. He's like, no, I didn't. So I said, when I give colonics, when I perform my procedures, I know how it feels every step of the way because I do it myself. I know what it feels. I know what's the outcome. You have 50% and probably 50 died. You have no idea what this medication will cause, what's the outcome, what's the long run. You have no idea of what's whatsoever how it's reaction. And you
I'm sure you
prescribe
love that.
it. Yeah. And I was like, but you prescribe it because it's $1,500 medication that's covered by insurance. So you chose it because there is 5 of them. And then, you know, that should cover what the symptoms are. And when I'm telling you, I'm going to take him to hyperbaric chamber later, you look at me like I'm a crazy ass person. And you tell me, oh, you can take, I don't know, maybe it's going to be a damage or not. And I'm like, what's wrong with you people? I didn't ask for your permission.
Right.
I'm
No,
just
no,
asking
absolutely.
as far as medication goes. Like, you know, and at the end of the day, my husband was like, Karin, he's a doctor. I'm like, so what? He's not God, you know? But that's exactly
there
the
you go.
perspective that people do have. They think that doctors knows everything. Maybe it was right to 20 years ago before internet, because today people ask questions. Before a doctor could give you whatever, there is one antibiotic to all the reasons. I'm not saying it's not good or yes good or for or pro. I'm just saying, like, they don't listen to you. And as if he was listening to what I had to say, he would maybe give me a great conversation of, you know, something, let's finish one thing, let's do the other, let's check the liver. I used to tell him what to check, and I'm not kidding. I prescribed him which system I want him to check back and back, like liver, like kidneys. And he looked at me like, why would I need to check that? I'm like, because in reflexology, his liver look like hell right now.
Yeah, let me
It's like,
just point out, I'd like to point out that I think it's the second or third leading cause of death is over 200,000 deaths a year from hospital mistakes.
Yes.
Hospital mistakes. So
Yeah.
people go, no, that's not true. I said, yes, it is. They look it up. Boom, it's true. It's the first thing pops up on the internet, unless they've censored it. But basically, you know, you're looking at that. So when somebody talks to me like that, I say, hey, here's the statistic. You guys got, 200,000 deaths a year from hospital mistakes. You'll excuse me if I don't want an advocate for myself while I'm in the hospital or
I was
while
nicer
I'm
to
under
him.
some
I
serious
was so
treatment.
nicer to him. I told him, this is the last time I see you, and I hope never to see you ever again. And I hope that
That's
we're
good.
not, I'm like, you're not the doctor I will refer ever. And when I gave him the list of the things I'm giving him, it was like, I don't know why you give him. And Steve, you probably heard about this tonic. I couldn't find it here in the state, but I'm sure you know probably of it. The oxytonic. Have you heard about the
Oh,
oxytonic?
there's different oxy products. So it may be one
It's
of those.
oxytonic.
We'll look
ooh,
it up.
it's coming
Well,
up.
that's the idea that that cancer doesn't like oxygen very well.
Oh yeah,
right?
yeah. Dr.
Yeah, so
Dr. Gooberman.
yeah, so what happened is that I have an oncologist in Canada. She's homeopathic doctor as well, and she gave me the I mean, she actually sent me all the herbs from Canada. So she gave me 2 oxytonic for him and some mushrooms. I have a whole thing because I couldn't get it here in the States from some reason. Anyhow, yeah. Yeah, don't you know, it's funny, but yeah, but it's
let me give you another interesting example. Was a friend of mine was a fellow chiropractor. We went to college together years ago, and he's out in the East Coast, and the first year of COVID, that summer he got COVID, and he got it pretty bad. He had a previous infection when he lived down in the Dominican of getting a dengue fever. So he may have been somewhat susceptible, but he caught a pretty severe case of COVID. And I was calling him up, and I said, well, did you go into, he said, I went to the emergency. And he said, what they say? Well, they said I wasn't sick enough and they sent me home. And I said, did they give you anything? And he said, no, they didn't give me anything. I said, you're kidding me. And so as I talked with him in the next few days, he got sicker and sicker, and he got so weak, he couldn't really hardly even talk to me on the phone anymore. He was so exhausted. So I said, listen, I'm going to call some doctors in your area just to see if they can give you something. And so I called a bunch of clinics in his area where he lived, and I got a hold of the doctors, and I said, hi, this is Dr. Rector from California. And a friend of mine is a colleague, and he's very ill, and he's just getting worse. And do you guys have nothing you can give him? No, we don't really give anything. And I said, well, how about hydroxychloroquine? And then they freaked out. No, we can't give that, or anything else. And the time, I don't think ivermectin was a thing, but I said, basically there's nothing you can do for him. And so I just called him and I said, look, I guess you're going to have to get yourself back into the emergency room, and do it right away. Call your primary and say, just, or whatever you have to do to get back in there, because, you're getting so weak, and this is going to cause damage, because it was the inflammatory response again, that we're right in the beginning, that reaction, Steve, you were talking about, that the over immune response that creates such an immune reaction that it causes damage to your lung tissue and maybe your heart tissue, wherever else it's affected, because it's locked onto the ACE receptors, etc. So basically, I said, get in there, and have him do something. And so he went in, didn't hear from him for a few days. He got out. I called him up. He said, well, I'm feeling better. And I said, well, what? They gave him a couple different things while he was in the hospital. And I said, well, what was the thing that you noticed worked? That was my question. And he said, well, it was the steroids. Finally, when they put me on steroids, I started to feel better because it reduced that inflammatory response. They also put him on remdesivir, which he's convinced did some damage to his kidneys. And so he's upset about that. He feels that he does have some permanent lung damage because he got in there too late. Wow. So he feels pretty bitter about his whole experience there. But he, in the end, I saw that, okay. And then they came out with the discovery of ivermectin and some other cross-purpose drugs that they could use to help prevent the symptoms from being so bad that you end up on a respirator, which means that 70% chance you don't get off the respirator, you die. So you had to sort of wade through this insanity that was being, about this pandemic that was just interlaced with politics and fear and the CDC just
a lot of stress.
Yeah, it was crazy. So what I learned from that helped me in the future when I got it, because I knew, okay, if it starts to really attack you and increase, you got to do the steroids, calm it down, and then you can use your natural treatments, and then hopefully you work out your immune system down the line. So yeah, so that's a pretty dramatic story, and I think if he'd left it too much later, he could have ended up on a respirator. So
yeah, and for your friend,
a lot of people did.
It's gonna be a great idea to do some hyperbaric chamber. It's amazing to repair the lungs again, like really, not just the lungs but the whole body. And it's, the result I see are amazing.
Wow. And you do that yourself at your clinic, right?
No, not in my clinic. I do refer people to other clinic. I don't have the ozone therapy, but I work with people that do it, and it's amazing. My husband by himself already did one, and he's gonna start to do 3 times a week. I mean, we're gonna start on 3 times a week,
Oh,
and we're
good.
gonna go down just because I want to repair everything. And he's gonna do some ozone therapy, like taking the blood, put
Yeah, yeah. Oh, yeah, yeah.
and
Yeah.
yeah, like ibotherapy
Where are you located?
in Tarzana, in the valley. My
Okay.
practice is colonics. That's what I'm known for. But I do colonics, detox, cupping, ear coning, every hole there is in the body.
Mm. Clean
You
it
know,
out, folks.
Yep.
I do know. Number one, Karin, I'm gonna start calling your phone the bat phone, because every time it starts ringing, that's when everybody's starting to look towards you to get back to your civic duty of helping them out of bad ways.
I know.
You know, one thing that really has struck me with this whole conversation, and Karin, you said it our last podcast with Hillary, talking about
Fatigue
the
and chronic.
autoimmune. Yeah. And and you know, you had said it, Dr. Brian, that you did this stuff on yourself, right? You
Right.
perform this stuff on yourself to see what it does for you and how it helped you. And Karin knows how this happens and what she does to people. And Steve, I know you are you know, you're a
He's
great
the
big advocate.
operator that does
Yeah,
that, like
you know,
connecting all
that's
the
yeah.
dots.
And one of the big
Conductor.
takeaways is,
Exactly.
for me, listening to you guys, it's like, you know, the homeopathic and the nature stuff are things that you guys know what it does to your bodies, right? And you tell people, well, I take this helps me in this way, as an example. But you know, you go to a oncologist, they have no idea. You go to, you know, some of these newer doctors, and they're like, I don't know, it just works. No, not really. And it doesn't surprise me, because I know Karin, I know what she talks about. Steve, we've talked to you before numerous times about and oh, by the way, I'm know we're trying to wrap up, but because of you, Steve, and because of you, Karin, like, I know I've gotten sick, like with the flu and allergies. I would go out and sit in the sun for
Yeah.
30 minutes, 45 minutes at a time. And it shortened. Normally, if I wouldn't have done that, it would have lasted a week, but it lasted a couple days, because I knew, sweating it out, listening to my doctors here, my 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 people, right? But it it surprises me how all this stuff that you guys are talking about, there seems to be some kind of a stigma that surrounds all this. And I know we're trying to wrap up, and so what I'd like to do is start with you, Karin. What is the biggest myth about colonics and what you do?
That I'm taking the good bacteria out.
Right.
That's
Yeah.
why everybody's so like, doctors will shout it out. But even though right now I see more and more and more and more doctors that are starting to come closer to me a little bit, and because now everybody understands that the colon is the second brain, and
Right.
everything starts and ends in the colon. Chinese medicine, herbs, homeopathic, Japanese, Indian, in Europe, everything starts in the gut. Gut health is very important.
Right.
What
Has more
doctor didn't
neurotransmitters in the brain.
Yeah.
what doctor didn't realize for the longest time, or maybe ignore it, is that the more substance they give, the worse of gut health they get. And that's how problems start. And that brings me again back to they don't listen, because you can go with same problem back and forth, and they still gonna give you Metamucil, some laxatives. And every time I hear someone say, but the doctor said that colonic is not that great because you take a good bacteria out. So I'm saying, like, in a very simple way, but prescribing Metamucil or any other laxatives there is around is not taking the good bacteria out. Of course it does. And yes, we do wash some good bacteria out. But that's why it's so important to take probiotics. And I'm saying take probiotics regardless. Always. That's a great tool for your immune system. So yeah, that's the biggest myth around colonics. But today, more and more people are talking about it and actually understand the importance of gut health. It's still a taboo, but again, I wrote a book about it. I'm trying to break that taboo every time again.
Yeah.
Every time.
Yeah.
And
Yeah.
it's gonna happen. It's gonna happen. It's amazing how people think, but at the same breath, I'm gonna say, when I first came to America, I started as massage therapist. In Israel, massage is not for fun. Massage therapist is one of the greatest tool for therapy for body aches, stress, headaches, pretty much everything. And when I came here to teach massage, they look at me like crazy again, because they're like, no, but massage is only for fun. And then, like mushrooms after the rain, because I used to work with chiropractors, each chiropractor had a massage therapist on board, because it was so important after adjustment to get a massage, or the opposite, to get a massage first and then adjustment. And the therapy was amazing. So what insurance company did, took that benefit out of chiropractors, because same thing. Why prevent medicine if we can hurt it? It's something that I never understand that. And it's pretty much in everything we do. But my relationship with chiropractors are amazing, because I'm working with so many of them. And one, I don't know if you know him, Dr. Dennis in Beverly Hills. Is also a well-known chiropractor. You know of him?
I have not. I've been out. I'm sort of retired, so I've been out of it for a while. So,
Oh, I got you. Okay, so he's like one of the top one. Everybody goes to him, and I'm like, and yes, it's very important. It's unfortunate that the insurances took it out, but because it's not fair. But most of the doctors I know and talk to today, detox is very important. Colon, like gut health, is very important. And we can see that, we can see it also in the food wise. Everything you're going to see good bacteria, gut health. So yeah, people do talk about it. It's the most important thing, I think, for everything: depression, anxiety, flu, back problem. Back problem. How many times people came with back problem and they're full of shit? A lot.
Yeah, exactly.
More ways than one, too.
Yeah.
I know. Yeah. You know how many times I'm getting clients that come with the extra that the actual chiropractor told them, like, go clean yourself, or the doctor told them, go clean yourself, you're so clogged, that's why you have back pain. So again, the listening, that's the key for everything. So yeah, that's the myth about my profession.
What about you, Dr. Brian?
Biggest myth about what would you say specifically?
Well, really, what you do, or whether it's chiropractic, what is one of the?
I think I don't know. To me, the myths are always perpetrated. There's sort of negative things said about a particular practice of medicine that isn't regular allopathic medicine. Now, if you look at doctors, so I always look at it like this: doctors are really trained in drugs and surgery. and that's what they know. And so let's sort of de-godify them a little bit and just say, hey, you guys are drug pushers and you do surgery, right? So I mean, I might need that,
Yeah.
So if I need that, I know I got to go to you guys. And also, you guys have great diagnostic equipment, and so you can really hone in on stuff. And so I like that part. And maybe I'll use all your diagnostic equipment, and then maybe or maybe not, I'll use your treatments of drugs and surgery, or maybe I'll use some other things according to my own discretion. Luckily, I'm trained in medicine, and so I know a bit about myself and what I might need. So it's kind of like, I think I'll decide for myself on that one. So there's times when I might need something stronger, like in the case of the steroids. And there's times when I say, that's going to end up causing me more problems. I'm going to try another route. And in the case, which is different severities, you have to really choose, and be smart enough to calm down and choose, because so much of it's based on fear. I mean, you can get a lot of clients out of fear,
Right.
So we don't really want to do, I don't like that. That's, I would just say, let's base it on, it's like you can just say, oh, hey, you're eventually, you're going to have a problem.
Yeah.
So you better do this,
Yeah.
Well, it's like, I remember it's like the car mechanic. Well, eventually that's going to break.
Right,
Well,
right.
yeah, you better
know.
replace it now.
I can say that the only myth I heard about chiropractor is like, don't do too much, you're gonna have loosened bones, or it's dangerous to do it too much, you can be paralyzed. I mean, there is always something negative to say about something, doesn't matter. Or don't take too much
Yeah.
herbs, or don't do there is a lot of things. That's what
Or
we
it's
have
just placebo or stuff like that. It's
I
like, and here's the thing that I like about the placebo thing is, like, they say, well, that was just placebo. And you go, well, let me ask you this. What is placebo? Let's define it. Oh yeah, it's mind over matter. So what you're saying is somebody's idea can actually cure themselves.
Oh.
And we should just throw that off like it's not, oh, it's nothing. Well, why is it nothing? That's actually probably the most miraculous thing you could ever think of, right?
Yeah.
If somebody's mind actually cured them because they believed it would.
Wow,
Oh, that's just placebo.
That's weird to hear. That's so weird to hear, because that's so
Mhm.
true. I mean,
it's not weird when you live in our world.
right. I
Yeah.
know. Steve, before we go, I know you have a lot to say, but this has been just a fascinating conversation. What is one of the biggest myths with homeopathic medicine that just screams and you're like, no, people, no?
Well, it kind of bounces off what Brian was mentioning about the placebo. 10, 15, 20 years ago, people were saying homeopathics were placebos because, they're sugar pills in a sense. Even though there's something on them, they're still called sugar pills. And we didn't agree with them. And then all of a sudden, somewhere in another country and in the United States, they started testing homeopathics on infants and animals. Well, you can't really make a placebo happen with an infant or an animal because they don't know what they're getting. They don't know anything of what you're giving them. And when they started seeing animals immediately respond to homeopathics and babies immediately respond to homeopathics, they no longer could say it's a placebo. Now, that doesn't mean that there's not some type of placebo effect with adults, because obviously they have more control over their thoughts and what they think they're being given. But an infant and an animal doesn't know any difference at all that we're aware of. So I want that placebo idea slowly has been fading away, but there's still going to be someone saying it's a placebo. It's just the way it is. I mean, when you saw Kaiser Permanente 5 years ago put up homeopathy all over their website, you have to start to wonder. I mean, Kaiser Permanente is not going to promote or post homeopathic medicine on their website. Well, now it's all over their website. It's everywhere.
Really?
Yeah, if you type in Kaiser Permanente,
Everything.
just type in Kaiser Permanente and homeopathy and it comes up everywhere. or just maybe Kaiser and homeopathy. Maybe you don't even need the Permanente. Oh yeah, it's all over their website. Just type in homeopathy, Kaiser Permanente, and you're going to see pages and pages and pages and pages.
Really?
Oh yeah.
Wow.
Wow.
Oh wait, yeah. Let's see if I can find it really quick here. Yeah, I was reading it the other day. Oh yeah, they talk about all the uses of it. They have lists for chronic pain, for all kinds of purposes. They even got naturopathic pages now. They list actual remedies now. It's very different. You know, they got complementary sections now. They're changing their way. They got pages on arnica by itself.
Amazing.
Wow.
Yeah,
Good.
they've changed a
We're
lot over the
getting
years.
to a good world.
Wow.
Yeah, I mean, Kaiser's not going to promote
That's
something.
positive news.
They're not going to post something that's specific, you know, a placebo in general. You know, that's just not what they do.
But that's a good news for us.
Oh yeah. I mean, for them to
Whoa.
list it, out of all companies, for them to list it's pretty big.
It's amazing,
Yeah.
amazing.
Yeah.
As much as I love to stay with you guys, I have
Yes.
Yeah,
Yes.
I also have to get going
And-
also.
I want to
Yeah.
have you again. So
We have to.
please, we
All
have
right.
to. Like, it's
We
so
have
much.
to.
It's so important to educate people about everything, especially right now with the holidays, after the holidays, New Year resolution, whatever resolution people want. It's health. That's the way we need to have our life. That's the way future is coming. I mean, with that being saying, homeopathic in Kaiser, come on. I would not go to Kaiser by myself, but hey, if they're promoting it, that's a new done.
Yeah.
Exactly.
It's
Yeah.
amazing because we've seen it through the year also with probiotics, and like doctors were against it a few years back, and now they're promoting it. So there is always something open up because Europe and the world is open. Internet is open. More and more people demanding answers. So it's a little bit different, and I'm happy to be a part of this world that helps other. And it was amazing having you on my show, on my podcast. Larry, keep entertaining them. I have to go.
Yeah.
Okay,
no,
well,
actually,
happy holiday colonics.
Happy holidays. And I
Yeah.
hope you're going to come to visit me, doctor. Come for a treatment. I promise you.
Absolutely, absolutely.
And you know what? And I want to know more about your product because if it's something that I can use in my clinic and inform
sure.
my clients, can be amazing too.
Right.
And of
We're at
course, if
Pacific
I have
Pacific
to-
Health, pacifichealth.com, by the way.
Pacific
So,
Health. Okay, Larry, take everything. Steve, again, thank
Bye.
you so much. Always a pleasure to have you.
Yes, pleasure with you.
Thank
You
so
guys,
much.
there is a long form podcast coming up. I know all about because this is such an interesting topic. Just thank you guys for being a part of this and coming on and sharing your knowledge and everything. Eric,
Yeah.
you want to go ahead and wrap us up?
Well,
And-
everybody, we just want to thank Steve, and I'm brain farting right now. Give me a second. Pause.
Dr. Brian.
Dr. Brian. We just want to thank Steve and Dr. Brian one more time for coming on the show tonight. It was absolutely wonderful and insightful, and we can't wait to have all of you back on very soon. Have a wonderful day, and happy Thanksgiving.